All right, we are recording and we are live. Take it away.
All right. Well, thank you, everybody, and good afternoon, Teaneck. This is Mayor Jim Dunleavy, and I'm accompanied by Council Member Michael Pagan. And we welcome you to our presentation on COVID vaccine to answer your questions with an emphasis on those questions from our residents and friends in the Latino community. We've assembled the panel of healthcare providers to answer questions related to the vaccine with an emphasis on those potential concerns from your particular community. Just to be sure, we are all in this together. We need everyone from every community in the surrounding area and the country to go and get a vaccine, get safe, so that everybody else is safe. In other words, we need you. Every member of our community, county, and country are needed in order to get this done. We need to reach that 80–85% level in order to create that herd immunity so that we're all safe and we can all return to hopefully some normal lives. So Mike, would you like to say a few words?
Yes, thank you, Mayor. Many in the Latino community have not been able to stay home during the pandemic because we are essential frontline workers. And as a result, the Latino community is one of the hardest hit communities in New Jersey, which is why our government, our healthcare providers, and our healthcare advocates are working so hard to help Latinos learn more about the COVID-19 vaccine. Some of the challenges we face are language, navigation of the healthcare system, the digital divide, and the documents that are required. And that's why we are here today. We want to make sure all Latinos, including recent immigrants, aren't falling behind in the shadows. Like other groups, the Latino community has its own fears about the vaccine. Immigrants and those who are undocumented worry that their personal health information will be shared with government agencies, but that information will not be shared with anyone. Pregnant Latinas are also scared about the safety of the vaccine. And these are some of the questions that we will be answering today so that we can help identify and eliminate barriers and help Latino residents overcome any hesitancy they might be feeling about the vaccine. This is an important public health message that we need to keep repeating. The vaccine is safe, it is free, and it is effective. And if you want to get the vaccine but need help making an appointment, the state hotline phone number is area code 855-568-0545. Again, that number is 855-568-0545. And you can call them from 8 a.m. to 8 p.m. and they do have Spanish speakers ready to help. Mr. Mayor, I'd like to tell the audience a little bit about our two panelists, and then we'd like to share a special message from United States Senator Bob Menendez that we have received for this program. Our first panelist is Dr. Gilberto Gastel, who graduated from the Universidad Central de Este, Facultad de Medicina in 1981. He works in Union City and specializes in internal medicine and family medicine. Dr. Gastel is affiliated with Holy Name Medical Center and Palisades Medical Center. Our second panelist is Deborah Latorre, who is currently the president for the National Association of Hispanic Nurses, the New Jersey chapter. Since 2010, Ms. Latorre has assisted and participated in the organization's various community health education projects, focusing on improving Latino health literacy and decreasing health disparities among Latino communities throughout New Jersey. She is a United States Army veteran of Operation Enduring Freedom 4 and continues to serve in the Army Reserves. She currently works as a family nurse practitioner, practicing in Northern New Jersey in an urgent care setting. She has over 10 years of nursing experience, including allergy and immunology, med-surg, post-anesthesia, and emergency and trauma. We thank you, Dr. Gastel and Ms. Latorre, for your willingness to be a part of our panel. And as soon as we finish playing this special message from Senator Menendez, we'd love to go over the 20 or so questions we have received for this Latino education seminar. Doug Roussillon, Mr. Clerk, can you please play the 6-minute video from Senator Menendez?
Doug, can't hear her.
Yeah, Doug, the volume. We're still not hearing it, right? Think,
No.
Doug, did you connect the audio? Can you please restart, Doug? Maybe we have to reconnect the audio. And sorry to everybody for the technical difficulties. And click the share audio button, please.
Yeah, I'm clicking that.
Thanks, buddy.
Still not hearing it, Doug.
Oh. Do you think we should adapt, improvise, and overcome? Maybe we'll ask our two panelists to speak, and then maybe we'll jump into a couple of questions until Doug tells us the technical difficulties haven't worked out.
Yeah, do that, and I'll get right back to you guys.
Okay, great. Thank you, Doug. No worries. These things happen, especially when live. Dr. Gestel, would you be willing to say a few words, or do you want to just jump into questions? And same for you, Deborah. Would you be willing to say a few words?
Well, let me just start by saying that I'm very happy to be here trying to reach out to our communities. It's very important to fight this deadly disease. On behalf of Salud y Familia from Holy Name Medical Center, I welcome this invitation. We're ready to roll.
Gracias, senor. Ms. Latorre, would you like to say a few words?
Yes, thank you. I just want to reiterate, thank you for the Councilman Mayor Dunleavy and the people of Teaneck. I love the appreciation that the majority of New Jersey has shown for our nursing profession and our medical professionals during this time. It has not been an easy fight, but we are here to serve you. And I just want to reiterate, together we can definitely conquer this COVID-19.
Thank you. Mr. Mayor, these questions came from the Latino community, the CDC, the State Health Department, and healthcare advocates. And we are ready to start the questions whenever you are, Mr. Mayor. If you could please lead us off.
Great. Okay. Well, I think we'll start off with probably the most global question, and that is, what are the barriers that you see to increasing vaccination of our Latino community? What do you see in your practices? What have you heard? What are the barriers that are causing people not to come for their vaccine?
I can take that one. So pretty much what I've seen out in the community and what I've noticed some of our nursing professionals facing is our Latino community is having difficulty with, seeing if it's safe. Is it going to be giving me side effects? Is it going to prevent me from going to work? As Councilman Pagan had mentioned, the Latino community is filled with essential workers, and we're out there working. And no ha parado, tú sabes. And we need to make sure and that we continue on with providing for our families and everyone that is here with us and our friends. So one of the things that I've noticed is a lot of our Latino community wants to know, is it safe, and will it stop me from going to work, and what are the side effects, and what else can we do to get the vaccine? Because right now it's a lot of like, I'll wait and see if so-and-so feels okay with it, and then I'll go. So that's one of the things that we've noticed. Another thing that we've noticed is language. Unfortunately, they are not sure on how to get to the vaccine. They don't know where to go. They don't know, they hear stuff from the news, but unfortunately it's not being talked about. The misinformation that we're getting within our Latino community is either from social media or Facebook or Instagram or other social platforms. And Dr. Google will not be seeing you in the office, but we want to make sure that our community knows that to trust reliable resources, CDC, your doctor, your pharmacist, your nurses, those are all reliable sources, and they should know, what's best for you. And we want to make sure that we reiterate that with our Latino community. You do not want to go and hit on these links that, you know, supposedly cure COVID or cure symptoms of COVID that you're not 100% familiar with, because we want to make sure that you are not doing unsafe practices to, you know, that may injure you, thinking that you're going to get COVID relief or, you know, protect you from COVID. We want to make sure that everyone is practicing safe in order to prevent this from spreading.
Déjame hacer un eco en lo que acaba de decir Deborah. Primero que nada, las barreras que yo encuentro es que la falta de información que a veces hay o las personas que siguen diciendo cosas que no son verdad sobre la vacuna, que altera el DNA, que lo van a hacer el gobierno para chequearlo donde están, etcétera, etcétera. Esas cosas que se están sucediendo, las personas buscan un amparo, o mejor dicho, alguien que los guíe para saber cuál es la verdad. Y ahí es donde nosotros tenemos, como profesionales y como miembros del Estado, llevar a cabo un tipo de diligencia a través de las comunidades televisadas, radio, periódicos, y decirle que mucha de esta información no es correcta, que se debe instruir a nuestra población sobre qué es la verdad del virus, que no es un virus, que no hay un virus en la vacuna, que se puede inyectar todas las personas, excepto algunas personas que tengan una alergia a un componente de esa vacuna, etcétera. Muchas cosas que hay que poner, pero que se debe distribuir a través de las iglesias, a través de las sinagogas, a través de todas las partes que podamos llegar hasta la última persona. Estoy de acuerdo con Débora, que la comunidad de nosotros es una comunidad que trabaja igual que todas las otras comunidades, pero la de nosotros, que somos la comunidad latina y que somos como decir, la espina de este país, ¿ok? Somos los que estamos ahí día a día en el frente y tenemos que llegar a nuestros hogares con el pan de cada día, como digo yo. Y es muy importante para ellos mantenerlo trabajando, etcétera. Y esperan que si tengo una reacción voy a faltar 3 días, eso no me va a cubrir. Y eso hay que instruir, que es mejor tener 2 días si te da una reacción o 3 días, pero seguir viviendo y seguir protegiendo y proveyendo a su familia de todo lo que necesita. La otra que tenemos es el personal clínico, ¿okay? Y el personal para dar las vacunas y la accesibilidad de los pacientes. Por ejemplo, en mi oficina yo les ofrezco que le tenemos transporte hacia el centro de vacuna. A todos los pacientes, no solamente los míos, cualquiera que quiera de eso nada más tiene que llamar a la oficina. Y lo hacemos gustosamente. Pero también no hay vacunas para todas las personas. Mucha gente están volcándose a diferentes lugares para encontrar la vacuna. Y esas son las barreras que yo encuentro.
Thank you, Doctor. Thank you, Deborah. A couple of people sent a message asking for the phone number. Again, the state hotline phone number to call if you would like to make an appointment for the vaccine is area code 855-568-0545. Again, that number is area code 855-568-0545. Doug, I saw your message saying that you think you worked out the kinks in the video because the audio was the problem. We can see it beautifully. We couldn't hear it. Is it okay if we try one more question before we try the Menendez video again? I'm going to ask one more question. Okay, Doug?
Go ahead.
Okay, the second question is, these vaccines were developed within a year rather than taking years like for other vaccines to be developed. Therefore, what steps, if any, were skipped to do that, to get this vaccine approved?
Ninguna. La vacuna es buena, se puede usar completamente. No volaron ningún turno en nada para hacer lo que es necesario para obtener la vacuna, lo que se hizo más rápido en el sentido de la emergencia que está ocurriendo mundialmente. Tenemos que ser más rápidos y los pasos que se dieron más rápido, pero sin evitar nada que fuera quitando cosas que nos dieran una información correcta para administrar la vacuna. Eso es correcto 100%.
And just to piggyback on that, doctor, gracias. Nosotros podemos decir que el gobierno estaba chequeando, hay criteria que es necesario para que vacunas hacen disponible para el público. We need to make, the government has agencies that make sure that the vaccine is safe. There are certain criteria that has to be met. Y si no mantienen esa criteria, no pueden hacer disponible para el público. So, es una cosa que nosotros como profesionales de medicina estamos averiguando desde el principio. And we would have, if those criteria was not in place or did not follow through, then it would not be available to the public. What we usually see, it's different criteria from what is with oral medicine. And es una cosa que nosotros vemos, una vacuna está más, cada vez que le chequean una vacuna o para ver si es buena y para el público necesita data. Data es que una cosa que nosotros como profesionales vemos y ve de verdad si es correcto. Va a ser bien para mis pacientes, por mi comunidad y por la gente que estoy sirviendo. Es una cosa que nosotros como profesionales estamos averiguando desde el principio, cuando las vacunas se estaban comenzando a hacer, qué es la data. Nosotros, eso porque es tan importante como pacientes a preguntar a su doctor, a preguntar a farmacia, tú sabes, en vez de ver social media para esa información. Y nosotros podemos, tú sabes, averiguarnos también como pacientes y ver que están los sites de CDC, de WHO, que tiene toda esta información ahí. La data de la clínica, potential side effects, as they say, y cosas que nosotros podemos averiguar si, mira, si estoy a riesgo para tener alergia a esta vacuna o no. Entonces, una cosa que nosotros necesitamos también como pacientes y profesionales necesitamos averiguarnos antes de decirle que sí está bien, pero hay programas de gobierno diciendo que mira, hay criteria que necesita ser necesario. It is necessary to have this criteria before it's disclosed to the public. It has to be done, and that's why there's that guidelines. Otherwise, we would have had those vaccines way earlier, but we wanted to make sure it's safe for the public and not just a majority of the public, for all the public.
Thank you, Mr. Mayor, because I know your Spanish is on an intermediate level. What they basically said was that no steps were skipped for this vaccine and that it is safe. Doug, do you think we can try the 6-minute Senator Menendez video again? Hey, Doug, are you there?
Doug, you there?
It's okay. We'll go to the third question.
Okay.
Mr. Mayor, do you want to run with the third question?
All right, let's if a person has tested positive for COVID-19 antibodies and never knew they had COVID-19, should he or she still get the vaccine?
You want to take that, Deb?
Yeah, I can take that. So that goes with hand in hand. Every person is different. Cada caso es diferente, tú sabes. And what we look and see is every person that we see, did you have symptoms when you had COVID? If not, we have to see and check your antibodies. There's certain levels with antibodies that we check and see. We normally do recommend that you get the vaccine because it's an extra layer of protection. It does not mean you getting the vaccine that we can stop wearing masks, we can stop being, social distancing. No, this is an extra level of protection. And we want to make sure that the more people who are protected, is less likely for COVID vaccine to survive out in the community. And that's one thing that we want to make sure that everyone understands. This is an extra layer of protection for us. And we want to make sure that we all get that vaccine and obtain that herd immunity in order to, be protected. Even if you had antibodies, we don't know precisely how much those levels are going to withstand or up to, to protect. We want to make sure that you have the as best protection out there as possible. So then that way COVID-19 cannot continue to spread and continue harming our communities.
Definitivamente todas las personas deben ser vacunadas contra el COVID, aunque hayan tenido la enfermedad, como por ejemplo yo. Se sabe que hasta ahora, por los primeros 90 días después de la enfermedad, tenemos anticuerpos contra el COVID. Eso no significa que usted tiene que esperar 90 días para vacunarse. Lo que sí sabemos que después de 2 semanas de saber que usted tiene el COVID o que lo tuvo, ya usted puede vacunarse sin ningún problema. Como ha dicho Deborah, estoy de acuerdo que esto es una pelea que va a durar mucho tiempo. Esta pelea no es solamente la vacuna y se acabó. Todos nos tenemos que vacunar, tenemos que ser y pensar en las personas que nosotros vemos, en lo que tenemos contacto con ellos, no solamente en uno, sino en todo, porque todos somos uno y no debe haber uno con COVID nunca. Esa vacuna se la debe poner todas las personas. No hay una razón por qué no se la pongan. Y esa es la conclusión que se debe tomar. Ponerse la vacuna, a no ser que usted tenga una alergia al componente de la vacuna. O si después de la primera dosis ha tenido una alergia severa, debe consultar con su médico, pero es recomendable no ponerse la segunda.
Thank you, Doctor. Thank you, Deborah. Doug, I think I got your message saying that you're ready now.
Yes.
All right, let's give it a shot, buddy.
Can you see the video?
Yes.
Uh,
We're still not hearing it, Doug.
Not hearing it, Doug.
1 second.
Doug, are you okay if I ask another question?
Yeah.
Go ahead.
Oh, go ahead.
Okay, our fourth question is, what is in the vaccine? Am I being given COVID-19?
No. The vaccine does not contain COVID. The vaccine, it contains a messenger RNA, which is to tell the cell to start producing a protein similar to the one that coronaviruses does. So the cell recognizes when the COVID virus starts producing this vaccine and enter our bodies, that this vaccine is harmful for us and is already primed about it. So the answer is no, it does not contain COVID.
Y yo estoy de acuerdo con el doctor. No, esta vacuna no tiene COVID adentro, solamente la proteína que va a ayudar a nuestro sistema inmunológico para a reconocer ese virus y para decirme, mira, ya sabemos este virus, vamos a mantener protección, mandar las células que es necesaria para eliminarlo. Igual como si cuando tienen la gripe y cuando tienen otras como cuando nosotros estábamos más chiquitos, nosotros teníamos varicela. Nosotros podemos decir que anterior nosotros mandamos a los niños, mira, ve a la casa a tu amiga para que todos puedan tener varicela, todos juntos, y porque es peor cuando estén adultos. Y nosotros ya no hacemos eso porque ya tenemos una vacuna. Es muy similar la vacuna, porque nosotros podemos decir a nuestro cuerpo, mira, has tenido ya esto o algo parecido y ya no sabemos cómo trabajar y eliminarlo para que no te enfermes tanto. esta vacuna, como dije antes, el doctor también editó, es que te va a dar extra protección solamente, ¿ok? So te va, en vez de ir al hospital o estar, tú sabes, tener intubado o algo así, te puede dar solamente síntomas de gripe. Y eso solamente que puede ser. Pero yo prefiero, como ya estaba yo vacunada, yo prefiero un día de gripe en vez de estar en el hospital. So es una extra protección para nosotros y no es COVID que está dándote solamente proteína para que ayude a nuestro sistema inmunológico para reconocer el virus y para protegernos.
Thank you. And Mr. Mayor, how about we just keep going with the questions until Doug says maybe he might have worked it out. And worst case scenario, if we can't get the video to play, we can just share it with our media.
I think I might have it this time if you want to try real quick.
You want to try one more time? Okay, we'll try one more time.
I found a magic button.
Hello, I'm Senator Bob Menendez, your senior United States Senator. I hope that you and your families are staying safe and healthy in these difficult times. Espero que todos ustedes y sus seres queridos se están manteniendo seguros y saludables durante estos tiempos difíciles. As you all know, this pandemic has hit our Latino community especially hard. Como bien saben, esta pandemia ha afectado bien duro a nuestra comunidad latina. In New Jersey, Latinos are just 20% of the population, and yet we account for 26% of COVID-19 cases. Solo somos 20% de la población en New Jersey, pero representamos el 26% de todas las muertes en el estado debido al COVID-19. The fact that so many Latinos work on the front lines as nurses and first responders, farm workers and grocery cashiers, warehouse clerks, and other essential workers has left us particularly vulnerable to this virus. And at the same time, many families are struggling to get by in this economy. Fortunately, we have 2 COVID-19 vaccines that are safe and effective, and I encourage everyone to get one when your turn comes by. Gracias a Dios, las nuevas vacunas contra el COVID-19 son seguras y efectivas, pero todavía nos falta mucho antes que todos nos podamos vacunar. As our mayors and local officials work to help as many people get vaccinated as possible in Washington, I'm working to increase vaccine distribution and improve access for our minority communities. Likewise, I'm fighting to help working families stay afloat in this economy through extended unemployment benefits, direct checks, targeted tax relief, and rental and mortgage assistance to help families avoid eviction and foreclosure. En Washington estoy trabajando para aumentar la distribución y mejorar el acceso de las vacunas con comunidades minoritarias, y también estoy luchando para ayudar a las familias que han sido afectadas por esta crisis económica a través de más beneficios de desempleo, cheques directos y asistencia para evitar el desalojo y mantener a las personas en sus hogares. I hope to deliver good news on economic relief in the days ahead. But today I am asking you to listen and to trust the public health experts. Make sure you're registered to get a vaccine. Do not be fooled by the misinformation on the internet. The science shows these vaccines are safe and effective at protecting people against COVID-19. Hoy les estoy pidiendo que por favor sigan las instrucciones de los expertos de salud pública y que se inscriben para vacunarse. No se dejen engañar por la desinformación en las redes sociales. La ciencia demuestra que las vacunas son seguras y sumamente efectivas en proteger a las personas contra el COVID-19. Yo mismo he tomado la vacuna. Getting vaccinated is critical if we want to end this pandemic as soon as possible. We all want to safely reopen our schools, get our economy back on track, and once again enjoy the good things in life, like spending time with family and friends. Nuestra mejor esperanza para poner fin a esta pandemia está con todos los que los vamos a vacunar. Todos queremos abrir nuestras escuelas de manera segura, volver a encarrilar nuestra economía y poder disfrutar de las cosas buenas de la vida, como pasar tiempo con nuestros seres queridos. The vaccine is available at no cost to all those who live, work, or study in New Jersey and meet the state's eligibility requirements. Please do your part and register for a free vaccine at covid.nj.gov. La vacuna es gratis para todos los que viven, trabajan o estudian en New Jersey y cumplen con los requisitos del estado. Por favor, ponga de su parte y inscríbese para una vacuna gratis en la página web covidvaccine.nj.gov. Our Latino community has endured great hardships during this past year, but we are strong and resilient, and we will get through this together. Please continue to wear your masks. Please socially distance, wash your hands, and do everything you can to stop the spread of COVID-19 and keep you and your loved ones safe. Nuestra comunidad latina ha sufrido mucho durante el último año, pero somos fuertes y juntos saldremos hacia adelante. Por favor, sigan usando su mascarilla, practica el distanciamiento social y lávese las manos. Haga todo lo posible para detener la propagación del COVID-19 y mantener a sus seres queridos seguros y saludables. Gracias. Thank you. And please be safe.
We thank Senator Menendez and his staff for that special message. And now we are going to resume our Q&A with our panelists. And Mr. Mayor, it is your turn to ask a question.
Okay, great. I want to insert here, though, a couple of things, because the public many times gets confused, unfortunately. There are really too many places right now in which for the public to go and register. They think they're in one place, they're not in it, they are in it. So I want to clarify something. There is a new site called Vaccinefinder.org. It is put up there by the CDC, and it lists many, many places by zip code, and it includes pharmacies and other places, and it will let them know whether or not they have the vaccine. It will then lead you to the scheduling system that site has, and you can get scheduled that way. In addition, you can go to, obviously locally, to holyname.org, where they are running our community vaccine center here at the Rhoda Center in Teaneck. In order to get into Rhoda, you have to do it through the holyname.org scheduling system. In addition, you have a scheduling system for Bergen County. And again, all of this is based on meeting the classifications that the scheduling system is required. So you have multiple ways in which to, and places now to get the vaccine. So I urge everybody to try all of them, because the sooner you all get in, the better we all will be. So let me just bring up the questions again, and let's see. Actually, I'll combine two because I think it's important. And actually, I was asked these questions today at our vaccine center. Are there people who have certain medical conditions or certain medications that should not take the vaccine?
The answer is no. The only contraindication for the vaccine, la única contraindicación para la vacuna, como dije anteriormente, es que usted sea alérgico a los productos que estén en el contenido de la vacuna o que haya tenido una reacción alérgica a la primera vacuna que sea una relación fuerte, no como enrojecimiento del miembro, no como calor, un poco de dolor de cabeza, fiebre. Eso puede tener los 24 o 48 horas. Cuando hablamos de reacciones alérgicas más severas, estamos hablando compromiso que tienen que ver con falta de aire, como que la garganta se le empieza a trancar, ponerse una urticaria completa, tener, como decir, los ojos o la cara hinchada. Esas son alergias profundas, grandes, que eso es una contraindicación. Pero la respuesta es no.
Yep. And I echo Dr. Gastel. Pretty much, we want everyone to get vaccinated as best as possible. If you really are unsure, ask your doctor, ask your medical professional. Si de verdad no sabe, quiere preguntar, pregunta a su doctor, pregunta a their medical provider, porque nosotros, como ellos saben tu historia, ellos saben las cirugías, las medicinas y todo que estás tomando. So, en realidad necesitamos confiar con nuestros profesionales de medicina. Mira, está bien que yo lo tome, está bien que yo estoy tomando la vacuna y estoy con familiares que tienen otras enfermedades, está bien si yo lo puedo tomar. Si quieren estar seguros, por favor, pregunta a su doctor o su provider para que sepa de verdad si es fácil. Pues sí, queremos que todos pueden tenerlo unless they have an allergic reaction. An allergic reaction, como Dr. Gastel had mentioned, you're having a severe facial swelling, hives, all that stuff, very difficulty breathing. Those are all things after the vaccine que nosotros necesitamos averiguar si tienen alergias. En eso son emergencias. Pero si da un poquito de picadez en la garganta, un poco síntomas de gripe, esos no son alergias, pero son side effects que puede pasar algunas veces con la vacuna. En esos 24, máximo 48 horas. So, algunas veces nosotros dirigimos, si quieren, puede tomar un poco de Tylenol, una sopita calientita, tú sabes, para ayudarle a aliviar esos síntomas. Y eso es suficiente, pero si tienen síntomas bien malas como la alergia, por favor, tú sabes, sí que ayuda de emergencia.
Yes, they could also take anti-inflammatories like Advil, Aleve, for any type of joint pains, headaches that may cause. But the symptoms will be self-limited and will last only 24 to 48 hours. Los síntomas durarán 24 a 48 horas si tiene un efecto secundario, y eso no es una contraindicación para ponerse la vacuna.
Mm-hmm. Yep.
Thank you. The next question is, should I take the vaccine if I already had COVID-19?
So that's a good question.
That's a great question. Let me answer that.
Yeah.
Okay. I had COVID-19. I have the vaccine on me. So therefore, you're looking at a person that is telling you 100% that it's a must. We just told you that if you have the COVID, you are protected. And we think the protection will last, the antibodies, for about 90 days or so. We're not sure 100% how long those antibodies will last. The antibodies will last maybe a year. We don't know that. We don't know if it lasts 6 months. We know that it lasts 90 days. And then it starts dwindling down. So my recommendation is, after 2 weeks of COVID, please get the vaccine. It's a must.
Mm-hmm. Mm-hmm.
Nobody's exempt.
Sí. Y editar, como dijo el doctor, no, si ha tenido COVID, sí puedes tener la vacuna. Si tú no tienes síntomas y todo, por favor, manténganse para registrarse para tener la vacuna. Si ha tenido COVID en el pasado, como dijo el doctor, nosotros tenemos anticuerpos para protegernos por un tiempo, no es permanente. So eso es porque es tan importante que nosotros tenemos esta vacuna después de tener COVID. Y como dijo el doctor, necesita esperar un poco de tiempo, pero no mucho, porque nosotros necesitamos asegurar que esa protección sigue. So, sí, pues, si has tenido COVID en el pasado, por favor, registrarse para ponerse la vacuna.
Oh, Mayor, you're muted.
Okay, let me just pull up another question. Even after I get vaccinated, do I or do all of us around me still have to wear masks and socially distance?
100%.
Ujú.
That
100%. Sí, nosotros necesitamos mantener la distancia social, tener las máscaras y todo, porque nosotros no todavía tenemos esta inmunidad durante nuestra comunidad. En eso porque es tan importante que nosotros tenemos la vacuna para obtener esa inmunidad sobre nuestra comunidad. Sin eso, vamos a necesitar estar con máscaras, lavar las manos, a tener la distancia social por más tiempo. Más rápido que nosotros tenemos esa vacuna, menos vamos a ver casos de COVID, porque el virus no va a poder sobrevivir si estamos haciendo todo lo que es posible para protegernos de obtener este virus.
we can say that the vaccines available to us provides a 95 to 94% immunity. There's a little bit that we don't have 100% immunity. That's one of the reasons that we have to protect ourselves. If we get the COVID while getting the vaccine or after the vaccine, the symptoms might not be as bad or might not be deadly because we already have a vaccine on that will recognize the virus when it comes in. And our antibodies ourselves will fight that disease. So it might be more like a cold or something like that. However, you have to protect yourself, and we don't know whether you have become a carrier, that you can still carry that to other people, and yet you not being infected or getting the infection. So therefore, the answer is yes, you must protect, you must keep social distance, and remember, it's not you, it's everybody involved.
Mm-hmm.
Yeah, there's a recent set of data that I saw that showed that if we go the current route of how much vaccine we're pushing out, and we take all the masks away, versus we keep the masks on while we're getting all the vaccine into our fellow citizens, the number of deaths that would be produced if we did not have the masks on, even though we were mass vaccinating, would be far, far, far higher than the expectation of us keeping our social distance, keeping our masks on while we're getting mass vaccinated. So it really can save lives, a great deal of lives, if we just continue to do that, even during our vaccination times.
Mm-hmm.
Agreed, Mayor.
I agree.
Thank you, everybody. The next question is, can I take the vaccine if I am pregnant? And can I take the vaccine if I am breastfeeding?
Well, the answer to that is we encourage people to have the vaccine, as I said before. However, there's no sufficient data up to today to say an 100% yes or no. Even though the OBGYN Association, Medical Association, states that they all should get it, but that we have the data to say yes, it's 100% safe. We do not have it to this day. We will have it in the future. But remember that this vaccine did not miss a step by recognizing the vaccine or getting it out to the public. However, we lack still certain avenues to know how much this vaccine will do in the future. For example, one of them is for the patients that are breastfeeding and those patients that are becoming pregnant or in pregnancy. We don't have enough data to say, yes, it's 100% safe, even though the CDC recommends it, and so does the OBGYN Society.
Ujú. Sí. Yo estoy de acuerdo con el doctor. Todavía nosotros no tenemos suficientes datos cómo esta vacuna puede afectar las personas embarazadas y que están dando de pecho. Pero la Organización de Obstetricia de Medicina dice que es posible que podemos darle la vacuna. Pero por favor, tú sabes, pregunta a su doctor. Tú sabes, otra vez, nosotros no sabemos qué estás pasando en su embarazo, si es complicado, así, pues nosotros dirigimos, por favor, que pregunte a su doctor. Y desde las personas que están dando de pecho, puede preguntar a su doctor también, porque no sabemos qué está pasando con el niño. Y por los datos no son suficientes por ahora. Como dijo el doctor, para tener esta criteria, no, they did not skip a step at all. They did not. Ellos mantuvieron esa criteria para todas las vacunas. Y la cosa es que en los datos no había suficiente personas que estaban embarazadas o ha tenido niños cuando estaba recibiendo esa vacuna. Pero el CDC y la Organización de Obstetricia dice que, por favor, vacúnate. So, por favor, si tienen dudas, por favor, pregunta a su doctor.
De acuerdo.
Mm-hmm.
I also want to note for everybody that, and I see it at my medical center at Trinitas Regional down in Elizabeth, and also up here at the Holy Name Vaccine Center. There is no cost. And also, if you do not have insurance, you should still register. You should still register. You're not going to get a bill, but you need to register because this is a public health crisis. And we need to get everybody done, regardless of people who have insurance, don't have insurance. You can get the vaccine. So please register wherever you can.
Mayor, if you don't mind, let me just add this in Spanish. Al público hispano que no nos puede entender en inglés, por eso tenemos a Deborah, al congresista Pagán y a mí para explicarles también en español. Por favor, como dijo el señor Pagán al principio, no importa que usted sea indocumentado, no importa que no tenga seguro, no importa que no tenga dinero, si recibe una cuenta de donde le pusieron la vacuna, del médico, de quien sea, no tiene que pagarla. Llámenos, le ayudaremos. Eso no puede hacer. No habrá nada de reportes a ninguna agencia estatal, ni federal, ni nada. Todo es para el bien de usted y su familia. Right there?
Absolutely right.
Okay.
Great. Mike?
Okay, next question is, if I do not get sick after taking the vaccine, does that mean it didn't work?
No.
Which means you're lucky,
No.
right? Yeah.
No. It means that, in fact, recently I have 2 cases like that. Okay? It means that you probably were infected already with the COVID and your symptoms were minor at the time and you got the vaccine and then they became more florid. Not because of the vaccine, it's because you were already being infected. Okay, actually vaccine protected you more to get worse, to be honest. Okay, and I recently have 2 cases like that. It's an excellent question. Okay, and I think the vaccine is life-saving on those 2 individuals, and I think it would provide for others as well. So the answer is, if you get the vaccine after the COVID injection, means that you had the virus in you. Remember, it could be there up to 10 to 14 days before it comes out on you. So therefore, no one can be tested every day to know whether you have the COVID in you or not. And sometimes A lot of people do not have symptoms that lead to believe that they have the COVID in them. They say, it's a cold, it's a runny nose, it's a little sore throat, it's the winter, etc. And that's something to think about. But it's not the COVID vaccine that gave you the vaccine or anything. In fact, it protected you to get worse.
De acuerdo, doctor. Si usted ha tenido la vacuna y no ha tenido efectos secundarios, no significa que la vacuna no está trabajando. Algunas personas que tienen esos síntomas de gripe o hasta pocas veces dolor de cuerpo, eso es su sistema inmunología trabajando, protegernos, tú sabes. Y como dijo el doctor, porque usted podía haber tenido COVID en el pasado con síntomas bien pocas, de gripe hasta síntomas de alergia, y dice que es la alergia o es la gripe, eso no es nada, pero en realidad podría ser que usted ha tenido ya COVID y recibiendo la vacuna, ya tu cuerpo ya reconoce, mira que ya nosotros ya peleamos contra eso, no necesitamos to worry about that. So, nosotros estamos diciendo solamente que por favor vacúnese, y si usted no ha tenido síntomas o secundarias, no significa que no ha trabajado, es solamente que su cuerpo y su sistema de inmunología está trabajando bueno y que está protegiéndole y reconoce esa proteína que está en la vacuna, que mira, ya nosotros ya peleamos contra eso, no necesitamos preocuparnos de avisar nuestro mente y cuerpo diciendo que mira, hay algo pasando. Significa solamente que ya nosotros ya peleamos contra eso, nosotros necesitamos, we don't have to worry about the symptoms as of right now.
Okay. All right, and I'd like to ask, I'm looking at the time here, we're still pretty good. A little bit more topical and timely. As we know, J&J just got its emergency use authorization for its vaccine, and I'm sure, I've heard the numbers of they being able to roll out 1 million doses, almost immediately. But we've also heard different percentages in terms of percentage. And I'm sure the public will be thinking, well, is J&J not the good one versus Pfizer? It's only one shot and so on. Could you comment on where you see the J&J vaccine fitting into all of this?
I echo Dr. Fauci. Everybody should get vaccinated, no matter which vaccine you obtain. You're already getting the protection. And we know the percentage are similar. The only difference that we see right now is that according to the 2 doses of Pfizer and Moderna, which is 94 to 95, and the first dose of Johnson is about 85 plus, okay? We don't know how much that plus is. However, it's a vaccine. And once you get the vaccine, no matter which one, you are gonna start already priming your cells, your antibodies, to recognize this virus. And if you get the virus, whether it's with any of the vaccine, it will be a minor type of disease. It's not be the deadly one. And that's what you need to be concerned. Get any vaccine that you can.
Sí, estoy de acuerdo con el doctor. Nosotros sabemos que en la nueva vacuna de Johnson & Johnson ha salido, y como profesionales nosotros dirigimos a nuestros pacientes y a nuestras comunidades que por favor recibe las vacunas. Sí hay diferentes porcientos, pero de verdad protección, un poco de protección es mejor que nada. Y nosotros necesitamos asegurar que nosotros estamos a protegernos con la vacuna. Si es de Pfizer, Moderna, Johnson & Johnson, todas esas vacunas te van a dar protección adicional. Y nosotros necesitamos asegurar que estamos a protegernos manteniendo la máscara, la distancia social, lavando las manos y manteniendo esa vacuna también, registrando. Si es 1 o 2, mira, cada vacuna te va a proteger, te va a dar un poco más de protección para ayudarte a no recibir el virus o tener síntomas bien graves. En eso con nosotros tratamos a decir nuestras comunidades, esta vacuna te va a proteger para que ustedes no tengan síntomas tan graves, para que usted no esté lejos de su familia o esté limitado en el hospital. Un día, 2 máximo de gripe, yo prefiero eso que estar en el hospital.
Mike?
Next question is, should a person with allergies take the vaccine, and does the vaccine change your DNA?
This is something that is being circulating on the internet for such a long time. And I get this question from my patients all the time. I'm sure you do as well, Deb. Okay. And this is far-fetched. Okay. This is a messenger RNA. It has nothing to do with a COVID per se. It doesn't change any DNA. It doesn't give the DNA to the government. It doesn't have particles that they could track you down later on. It doesn't do any of those things that are circulating in the internet. This is false. Okay. Senator Menendez alluded to that in his speech as well. The vaccines are safe, and this is a method to save your life and to the others that are around you, whether you know them or not, whether they're your family, your friends. Everybody should be vaccinated. And this has nothing to do with DNA, has nothing to do with particles that is going to change your DNA, or is going to report to the government, or they could track you, whether you go to Africa or here or there. Has nothing to do with that. Please get vaccinated.
De acuerdo, doctor. Yo también tengo esas preguntas de algunos de mis pacientes, y este es un buen ejemplo de la misinformación que nosotros estamos escuchando de nuestros pacientes. Vacunas o toda la vacuna no tiene ninguna cosa que te va a ayudar el gobierno a encontrarte, ni dar tus datos, nada de eso. La vacuna tiene proteína de mRNA y esa proteína te va a ayudar a tu sistema inmunológico para que reconoce ese virus. Solamente no va a cambiar tu DNA, no te va a hacer te va a crecer algunas cosas también escuchado por internet, pero nosotros necesitamos averiguar, saber qué es de verdad, qué dice la ciencia. En realidad, la ciencia está diciendo que en la vacuna tiene esta proteína que puede ayudar a tu sistema a reconocer este virus y para que te ayude a pelear contra este virus. Tener maybe un día, máximo 2 de síntomas de gripe, pero no debe ser más. Y prefiero que eso pase en vez de estar en el hospital, a necesitar oxígeno o, tú sabes, otras cosas que pueden ser más fatal. Y nosotros estamos exigiendo, por favor, nuestro público, nuestra gente, vacúnase. Okay, vacúnase, lleve sus familiares, sus primos, y si pueden, hasta sus hijos, cuando pueden obtenerlo, vacúnase, porque estás protegiendo solamente no a nosotros, pero usted, sus familiares, a todos. Y la cosa es, nosotros no queremos perder otro miembro de nuestra comunidad o familia, porque no tienen miedo a que el gobierno te va a encontrar o algo así. Es mejor protegerse ahora de este virus en vez de tener posibilidad de consecuencias que puede ser bien grave.
Déjame añadir, let me add, that is part of the misinformation is saying that this is something new, the messenger RNA that we're using, the vaccine, and so forth, and this is something that is innovative. This is not. Déjame decirle que esto del mensajero RNA no es nuevo. Por favor, esto se está usando ya, el messenger RNA, el mensajero RNA, en medicinas para en contra de cáncer y otras enfermedades. Eso va a ser una de las nuevas armas que vamos a tener nosotros para fajarnos contra enfermedades tan mortales como el cáncer y otras de ellas. So please, messenger RNA is something that we've been used on other diseases that we are doing already, like for cancer treatment and for other diseases treatment. We've been using the messenger RNA. This is not innovative in this. This is not being done now. That's
Yep. Sí, estoy de acuerdo con el doctor. Esta meta de usando mRNA no es nueva. Nosotros estamos usándola con otros diseases o otros como cáncer así. Desde, yo estoy viendo la lectura de hace casi 13 años, ya estamos usando este meta. So nosotros, no es una nueva maneuver, nueva cosa que encontramos o estamos divisando para, pues esto ojalá puede ayudarnos. No, esto ya con la ciencia está diciendo, mira, estamos usando esto más de 10 años y esto trabaja. Vamos a hacerlo con el coronavirus y vamos a protegernos de esa meta. Es no diferente, sí, las otras vacunas como polio y todo son más viejas, sí, pero esta no es una nueva meta. Nosotros estamos usándolo ya más de casi ya 13 años, no es nueva. Y nosotros vamos a, ojalá, a obtener esta vacuna y protegernos más cada día.
Well, I think we have got to our hour, and I want to thank our partners here, Dr. Castell and Deborah Latorre. This is great information. I'm sure it's going to be helping many people make a more informed decision. And I think from this, I hope everybody hears the message loud and clear that in order for us to beat this, we are all in this together, and therefore everybody has to get vaccinated in order to beat this dreaded disease. I just want to remind everybody before Michael makes some closing comments that the session was taped. It will be at our Teaneck Township website at www.teaneck.gov, and will also be available through our Facebook page, and we will be putting it up on the public access channel. So Councilmember Pagan, you have any final comments?
Yeah, really quickly, I just want to say thank you to several people and several organizations. Thank you, Dr. Castell, Ms. Latorre, Holy Name Medical Center, the National Association of Hispanic Nurses, the Statewide Hispanic Chamber of Commerce of New Jersey, Desiree Ramos-Reiner, Gerald Reiner, Luis de Paz, Doug Roussillon, and the Teaneck Council for helping make this Latino education seminar happen. It means the world to us that we were able to put this together and provide so much helpful information to the growing Latino community in Teaneck and beyond. So thank you. Muchas gracias. We appreciate all of you for helping make this happen. And please be safe out there.
Take care, Teaneck. Be safe. Thank you again.
Thank you.
Thank you.
Bye.
Bye.